Hi everyone, Jody here from Healing Journey. And I just wanted to update you on a really interesting talk that I listened to today as a part of the SIBO IBS Summit. So as you know, this summit is completely free and has lots of awesome information on IBS and SIBO and gluten-free stuff and just tons of different speakers every day that you can sign up for. So for today, I listened to a speaker on tick-borne illness because this is near and dear to my heart and my health story. And I wanted to share it because it's kind of very cutting edge. And not a lot of people are aware of this link. So as you may know or may not know, I got sick in Africa 10 years ago, and because it was in Africa, the assumption was always that it was an amoeba or some weird parasite that was causing the issues. Did lots of awesome gut testing that helped me to treat a lot of bacterial infections and identify H. pylori. But for some reason, the chronicity of my gut issues was maintained. And so that's when I started to dig a little bit deeper and realized that there was something impacting my immune system, which was then impacting my gut health. And so today's talk was actually on the link between Lyme's disease and other tick-borne illness and chronic gut issues. And so some MDs, unfortunately, most of them are from the States, not necessarily from Canada yet, are starting to recognize that. So there are a few GI specialists that when they have someone with gut issues that's really, really chronic and they're not responding to typical protocols, whether it be antibiotics in the medical community or in the functional medicine community, it would be protocols to deal with bacterial infection. And so maybe they've cleared the infection, but the gut is still kind of not showing symptom improvement. That's when people are now starting to investigate on whether there's tick-borne illness. So Lyme is one tick-borne illness. And so I think there's a lot of confusion about this. There is Lyme, and then there are Lyme co-infections. And so these are infections that are often transmitted with Lyme, like Bartonella, Babsiella, and lots of other infections that can really impact the immune system and also can be a little bit like Lyme. There is one infection that looks like Lyme and acts like Lyme but is not Lyme. So I'm bringing this up because if you have been struggling for a really long time and have done a lot of work on your gut and still aren't seeing any improvement, you might want to think about whether there's a co-infection underneath it. And only 5% of people that have tick-borne illness actually remember being bit by a tick. There's actually a lot of other ways it can be transmitted. So fleas is one of the main ways that it can be transmitted. So you don't necessarily have to remember being bit by a tick. I don't. You don't necessarily have to know that you had a bullseye rush. I don't. But if you have these chronic symptoms that might be impacting your body's ability to fight that off, that's something you want to look at. There's also saying that some tick-borne illnesses are actually living within the nervous system of the gut and causing issues there. So I think we're going to start to see a lot more research on this. I know, unfortunately, within the conventional medicine community, chronic Lyme is not really recognized, but it most definitely is recognized within the functional medicine community, and there's some really great DNA tests that you can do that will detect whether or not you have Lyme and co-infections in your body. So if you have any questions, I'm happy to share more about this. I'm also going to share the link. If you didn't catch the talk today, I know it's going to be on till the end of today. You can also catch it at the end until the end of this week. So they'll do a replay at the end of this week and you can just scroll through and look for that. Alrighty, have a lovely evening.